A very good evening to all of you. Today, I have a bunch of gorgeous ladies who will be joining with me shortly. Well, let me tell you that what exactly we are here for today. Today, we are going to discuss a very important, important area when it comes to oral health care and oral health care research, or per se, oral health care evaluation, diagnosis, treatment, prognosis. So the world has changed. The world has been dynamic for the last couple of years. And with the advancements in research, like for example, we have come across the era where right now we know what is inside our DNA, or we can predict diseases with technologies like genomics, like any molecular diagnostics. Like, for example, now, all of you know what is RT-PCR. So that is a molecular diagnostic technique. Even if you are not from the scientific background, but still you have some idea because that was just for because of COVID. So in this way, it is time that we also, talk about and understand the perspective of interdisciplinary science when it comes to oral health care. So I'll quickly bring all my guests in here, and we will have a jam packed session. So stay tuned with us. And if you are in the live session right now with us, then just say your presence in the comments. It gives us a lot of motivation. So here I go and pull in all the young energies on board. Thank you so much, Dr. Roma, Dr. Padmavati, Dr. Shalin, Dr. Mayuri, and Dr. Swapnika. Thank you so much for joining today in this panel discussion where we will be trying to create awareness regarding the existing challenges and what would be the possible solution when it comes to interdisciplinary perspective or research in terms of oral health care. I welcome all of you and thank you so much for accepting my invitation to this panel discussion. How are you guys doing?
All good, ma'am. First, it's actually a thank you for you to asking us to join with you, ma'am. It's an actually an honor.
Thank you, Padma. Thank you so much. And Swapnika is very early, so good morning to Swapnika because she's very enthusiastic that she has joined so early from US here with us today. Thank you, Swapnika, for that. Well then,
Pleasure is all mine, ma'am.
so let's begin our fantastic discussion. And as you know that I always say, and I have been till now like that, inquisitive learner. As a student, as an academician, as an entrepreneur, I am still learning. So today is again some new learnings that I want to harness from your perspectives. So and just to mention to all of our audience that right now, among our other participants, all our panelists whom you can see on screen, they are already the ongoing participants of our ongoing fellowship program, which is online program, that is fellowship in dental genetics and clinical research. So they have a widened mind already because they have been exposed to a fantastic science already. So let's learn from them and see how the changes should happen and what exactly can we do in this aspect and how much we can contribute from each of our bit. Well then, uh, Padma, I will ask you the first question.
Yes,
So
ma'am.
before that, please tell our audience who you are and what you do at present.
So, very good evening or good morning from whatever place you guys are. And I'm here, Dr. Padmavati, a third year postgraduate who's just 6 months away from my finals. I'm doing my specialty in an MDS in oral medicine and radiology. And I'm from Chennai. Yeah.
Great, that was great. Well, so I think your exams are knocking on the door, and still you are on a panel. That's really enthusiastic.
Yes.
All right. So, Padma, just a very simple question. Like, when it comes to approaches towards oral health care, we are more, our education makes us more technique based. So, my question is that Do what is your opinion, or do you think that would it be an ideal way to make oral healthcare approaches more holistic in nature?
Uh, to answer that question, the thing is that first we are supposed to be aware of what is holistic in nature. So to tell that, people think that there's a lot of controversies around the holistic being a traditional. They get it confused with the Ayurvedic medicine or with the traditional medicines and etc. etc. So holistic is, as one of the ASA has defined, they say that it will be you take care of a patient of all aspects, not just your medicine. You try to take care of the patient's physical status, the emotional status, the spiritual status, the social status, the socio-economic status of all. When we see as these holistic cares onto the medicine side to our counterparts, the nurses play a major role there. The nurses, the staff nurses, they spend a lot of time with these admitted patients rather than the doctors. But in our specialty, we don't have such kind of system. We don't usually admit the patients to us and go about. It's always an walk in and walk out of OPs. So I'd like these young minds or these young BD students or the undergrads or even the postgrads, we need to know what an holistic care is. Because giving, for instance, say, it's not just people suffer only from, these chronic illnesses in medicine side. There are many more things in dentistries. You say these autoimmune diseases, you speak Behcet's. Basic start with the lichen planus. Walk in, walk out, you see lichen planus 2 cases per month. That's like now, and TMDs, more common stress related problems. So all I need is that we also do have chronic illness patients. I myself have had certain patients who have had a follow up for say some 8 months, 9 months. Like it's like they come for a follow up every 2 weeks or once in a month. So when we come, we have such kind of patients. We need to be supportive of their, not just their physical, not just relieving their pain. It's not just writing some NSAIDs or some morphines just to relieve of their pain and send them back. You need to sit with the patient. You need to talk. You need to get to know them so that, see, it's not like every patient has a separate fabricated, the way we treat them. The medicines can be same, but the way you approach a patient should be different. That's what I like from my point of view. There are studies which they have tried to do among the postgraduates. There are many review articles and questionnaires where they try to see the awareness among these holistic care in dentistry, to be in very specific, among the postgrads, even in the faculties levels. The results are very alarming as they think it's not necessary. The thing is that we think it's not necessary, but it is not so. We are actually indebted to the patient to do so. We are supposed to take care of them of all aspects. We don't have the staff nurses in point. So it is up to us to take care of each and every single patient. So each and every single doctor, per se, we need to do that. So I'd really be thinking on that aspect. So yes, as a holistic care in dentistry, it's not a new one we've been following, but these recent time articles, again, you see, they try to speak about these biocompatible restorative materials, non-mercury restorative materials, and switching up formaldehyde for something else, or switching up to food-based medicinal things for your treatment plan. It is not just about switching up things into organic or organic in nature, but it is also to
Correct.
take them part in every aspect. So
I
yeah,
agree.
that's what. Yeah.
Thank you, and that was fantastic insight from you. Because you, at this point, you are actually into hardcore dealing with patients like this daily, and you are also inside the system. So your perspectives are really, really insightful. And as you say, that it is very important to understand what exactly holistic means even before we speak about it or try to take those things in practice. Thank you, Padma, for that wonderful answer. Well, then, now
Thank
that we
you.
are talking holistic, welcome. We are talking holistic medicine or holistic dentistry. So, therein something is going on in my mind. So, I think, well, Swapnika, I would like to ask this question to you, that when it comes to research, because research is seen, the term is seen in a different way completely. It always seems like somebody with specs sitting inside a lab. It's not like that. With clinical data, we can also do a lot of research. So from that perspective, I would like to ask you, as a new generation dentist, that do you find it hard when it comes to research related in dentistry? And a related question would be that what are the most common things that appears in that way challenging in this aspect to you? What would be your take in this? And before answering, please let us know who you are and what you do at this point.
Hello, everybody. I am Dr. Swapnika. So, I actually graduated my BDS in India in 2019. And then I actually recently moved to the US and I'm trying to build my dental career here. And I've been preparing for my INBD exams. So, that is where I'm at right now. So let me start off like by saying, there's been an article that I read by NCBI a few months back that kind of mentioned this fact that, there's only like 10% of dental care that is actually based on validated research, and that it might take around 17 to 20 years for that foundation knowledge research to be applied to dental care or patient care. So I totally, like Dr. Padma said, I totally relate and understand what she told. So yeah, so when I read that, it actually really intrigued me as to understanding this gap, and going more into understanding the research side of it. So, as a new graduate, fresh graduate, and a newbie to trying to understand where research is coming from or what we need to understand, especially about the research side of it, I did find it a lot difficult because I'd say the biggest and the most common challenge that I've seen or I've heard of, or in my personal experience, is that the lack of our foundation knowledge about research and the research methodology, if I may add. So, the basic questions that I've seen asking myself a lot of times was, where do I start or how do I start? And most of this comes from the absence of research environment in our undergrad universities for students, especially. It could be a lot of reasons. If I did actually find a few people working in research, it was the lack of communication and the lack of questions. Like, what do I ask, or what how do I get involved in something like research? So uh, so from there is the another big challenge is our perception of research, like how research is slow and expensive. And for new students like me who've just graduated, and in this world where building careers is a race, and you want to be successful faster. So for new students, it's always a question, how much time do I have to contribute to research, or what are the resources? I am financially restricted. So how do I go about challenges like this? And from here comes a fear of failure, and the fear of taking risks because you're already in your comfort zone and people are not sure if they want to get out of it, and uh, go ahead and try something like research. And also the absence of guidance for a lot of people who are new into this. There is definitely a lot of information, but people don't know how to get it or how to consolidate the right data. and these are definitely the issues. So even if we say we are past it, we don't know the execution part of it. So here I definitely want to uh, add and mention that the fellowship program that we all are enrolled in has been a great help. At least, that introductory courses to understanding clinical research and the aspects of it and how vast it is, and all of that is definitely a help for somebody who's just trying to understand where it's coming from or what we need to focus on. So with this, say we are past these kind of challenges, you actually get to a point where you want to do your own research. So here comes the biggest question for me, is how to choose the right topic, or how to choose the right kind of work for research that would actually add some value and would actually help and be useful in patient care. So this was my biggest question. Like, I don't know, see, now that we are in a space where we understand, okay, what is going on, and we are trying to put our steps into research. That's the biggest question I have, and that is what I've kind of wanted to ask you, Dr. Gargi, because it's great that we are actually with you and trying to understand this. And I don't think there's anybody better who can uh, give us an idea about all of this and how to add value and how to actually make our research useful. So
Thank you, Swapnika, and I will just come back to your question. I'll be very happy to answer that. But just that before, I'll just take the conversation forward. First, I will learn from you. So your question is in my basket. I'll definitely answer this, and that's a very valid and very candid explanation from you, which I'm very happy to know this, because these are the real problems, and we really need to find solutions. As I said that we just cannot keep complaining about something which is not existing, but I think we can just do our bit. So if changes one life, two life, that would create a chain reaction. This is my understanding. So we'll just keep the thread of conversation going, just taking other our friends views, and then I'll come back to your question. Well, so coming to Dr. Roma. So Dr. Roma, what you are doing at this point? What do you do now?
Yeah, first of all, good evening, all of you and the viewers as well. So, right now I'm practicing in Pune in a private dental clinic setup. So, that's all. Oh.
Oh, that's a big thing. It's not that's all. I mean, you are doing the
Yeah,
real work.
yeah, yeah, and
Okay. So that's really nice to know. That means you are into a hardcore, day
yeah,
in, day out clinical practice. So
yeah, and
I think, yeah, yeah, please tell me.
along with that, I'm doing that dental genetics, a fellowship in dental genetics
Yeah,
and research. So that is also a great experience with you, Dr.
great.
Gagi.
Yeah. So I think this question, which now I would like to ask you, because we are going step by step ahead. So
Yes,
is that, like, since you are into clinical practice, so you would be the best person here to answer this, because so
yes.
what you think, like as a clinician
Mhm,
particularly, what do you think that
mhm.
what should be that one change, or what should change in the field of oral health care or dentistry per se, to elevate the profession to the next level? This question is definitely in perspective of India, our
Yeah,
Indian system. So
yes.
what is your insight as a hardcore clinician? It will be very valuable to everybody here, and also to our audience. Yeah.
Yeah. So first of all, I'm practicing since past 5 to 6 years to the current date. So what I think is that this is the question that you have asked is the two-way, like from patient's perspective and from the dentist perspective. So currently in India, the oral health awareness is, in that we are lacking behind very much. So from the patient perspective, I will say in the regular practice, I see there's many kind of patients with the general health issues they come, and along with that they have oral issues as well. So somehow these are related, but the patients are not aware of that.
Hmm.
in current scenario, because I have seen the diabetic patients who come to us, and they have, gum health issues and periodontitis, and you can name it, like there are many issues, but they don't know that the underlying cause is the diabetes, which is causing the oral health issue along with that. So first of all, we have to make patients aware, because it is our responsibility as a dentist. We know that these all are interlinked, but they are not aware. So it is our responsibility to make them aware that the oral health is just not about 32 teeth and how it looks. Okay. So in the research and studies, we have found that the heart issues are also linked with the oral health issues. See, the composition of the dental plaque is similar. It is found in the studies that it is similar to the plaque which is found in the arteries in the
Right.
atherosclerosis. So
Correct.
this is a big problem. Somehow we are not taking care of our mouth, and we are creating some underlying diseases, and then we go to dentist when it is very severe, and it is beyond our control as well. Okay. So in this kind of thing, we'll just have to improve the patient awareness. Okay. And then the dentist perspective, I will say, we are lacking in the research field, as all the doctors are saying here, that we are lacking that knowledge. Then if we can improve this, you know if we can do more research and more studies about it, and we can collect more data about it, that how the disease gets started, at what stage it is starting, and at the molecular level as well. So we can improve our treatment, whatever treatment we are giving, whatever medications we are giving, and in every aspect we can improve it.
Right. I completely agree with you, and that was
Yeah.
wonderful perspectives, very real,
Yeah.
daily that the practitioners face. I mean, even the
Yeah.
students. I mean, who are
Yeah.
now a learner, who are going through the journey of learning dentistry. That was
Yeah. As
fantastic,
a
Dr. Roma. Yeah.
Yeah, as a student, when I was in college, I also used to think, like Dr. Swapnika said, that how to do research and to whom I should approach, because there was lack of awareness from our side also, and
Right.
like we were not knowing to whom we can approach for the research thing, and how we can connect the practical aspect and the research thing, how we can apply those in the day to day clinical practice.
Correct.
So these
Correct.
are the things.
Yeah. Thank you. Thank you so
Thank
much.
you. Thank you.
Well, so now that our program today is talking, we are trying to create awareness as well as discuss the present challenges in perspective of interdisciplinary oral healthcare and research related to it. So, Dr. Mayuri, do you think that an interdisciplinary approach to attend the oral problem is better than the conventional or traditional approaches? And if yes, why? Why do you think so?
Good evening, everyone, and our viewers too. I'm Dr. Mayuri, and I have done BDS. After that, I have done MSc in Forensic Odontology, and right now I am Assistant Editor in Croynas Private Limited with Gagi ma'am. And I am a person who is very much too much passionate about research. As ma'am asked, maximum of the answers are already been discussed. I just have to take the summary of it and put it in front of you. As Dr. Roma told that oral health and general health is very much related, because I'll start with WHO definition of health. It is defined as complete physical, mental, social, spiritual well-being. So oral health and general health is always related. But
Right.
as Dr. Rama told, there is very less awareness about that in patients as well as dentists. That too, when the patients comes to dentist, the time is very late. Like disease have progressed to much serious extent. And first, I'll speak from patient point of view that we know that dentistry is expensive. This is the fact, and
Correct.
that's why the patient, mostly patients are very reluctant to visit the dentist. First of all, the thing is that, and second thing, awareness is not there. Actually, I think when I was doing my internship, I found that many patients who are from villages, they told us they have never brushed their teeth, never. They were 25, 26 years of age and they have never brushed. Like seeing their oral condition, dentists will like feel puking. That such kind of
True.
conditions are there. So patient first thing is not aware, and second thing is uh, dentist also, like we have the tendency, what I feel, that whenever a patient comes to a dentist, or I'll say physician, for example, a diabetic patient went to will go to a physician, he's taking treatment of diabetes, everything. So we have that habit that we will try that from our side, at least the patient, we can cure the, we can treat the patient. But when the thing progress, that when we feel that patient is not recovering as our expectation, then only we have the habit of referring to a
Right.
specialist. So oral health, general health, and the root is in, I think, what I think, that everything has the root in genetics. So this awareness, these three things are very much related, and it's high time that in our what I say, undergraduation, post graduation, we must amalgamate these three things, that is dentistry, general health, and plus genetics. What I feel, when a interdisciplinary team will treat a patient at a time, first thing, the patient's time will be saved, and in every step patient will be always involved. Second thing, cost. If every part of the team is working together, then we don't have to go for this diagnostic procedures again, because whenever we go to a next physician, they will start from zero, because they want to see what is there from right to point zero. I think they start from negative only. So the patient has to undergo such a like they are all exhausted, their money is gone. So I feel that this interdisciplinary thing can benefit patient. We have seen that we have mostly villagers and there, so it will, the cost will be cost effective, it will be. Second thing, when all the team will sit together and come to a conclusion, then it can pop out some comprehensive treatment care. And second thing, tailor made, custom made, specially made for that patient. Because if we are including genetics, it is definitely there that a treatment care will emerge, that is one shot treatment for all the problems. So I feel yes, it is definitely yes for interdisciplinary approach to an oral problem. Traditional method is good, conventional method is good, but it is high time we should include. And it's my request, if higher authority or somebody is seeing this like we watching this, so I think we should start teaching research, and we should encourage interdisciplinary thinking right from our undergraduation. Thank you.
Thank you. Thank you, Dr. Murray. That was wonderful insight from you. And I think now that you are talking about education and you are talking about awareness, so this brings me to Dr. Shalin, where I think she is also in a preparatory stage. So, Dr. Shalin, what do you do now? We are all very excited to know about you.
Thank you, Dr. Kaji. That's exciting. I mean, knowing that people are ready to hear. So I am currently I've almost been practicing for almost a year now, and I graduated in year 2020 from Manipal College of Dental Sciences in Bangalore, and that's about me. And so far I've only realized the importance of having a holistic approach, as Dr. Padmavati had mentioned, and like the deeper the problem is what I'm realizing, the more we need to do and the faster we need to do. So
Okay, that's very nice to know about you. And I think you are. I think you grabbed this fellowship course. You are inside this fellowship course at the very at the right stage. So I think in the later part you will be a very good point source or resource to take these messages forward, I think so. So well, as Dr. Murray told about awareness, education, even Dr. Roma told, so when it comes to awareness, definitely it is about education or courses that that comes in our mind, obviously. So what kind of education or courses do you think would be really helpful for students? Because I think you have just come out of the student phase at this point, with a year of experience, or early researchers to acquire the technical knowledge as well as upgrade themselves on a personal front in the field of oral health care.
Right, that's a really good question and a really big one. So, to tackle it one by one, so we do have independent courses like across the board for dental education and dental training, or we would have independent courses for like biomedical sciences or biomedical training. But what we lack, or what I don't see, is a collaboration between different professionals. So, for example, we talk like across the board during this discussion, we've seen insights from all the panelists here saying that we need a holistic approach, and we need to take care of all aspects of patient care, and that comes with knowing that you need to do that much earlier than graduating. So maybe what we really require is like a panel or a forum, could be online, could be offline, but an opportunity to provide that exposure to stimulate discussion between different professionals. So not just
Correct.
tender professionals. Right. And that's something that, like Dr. Gagi, you do fantastically. You create content and you have a platform where anybody who just searches dental genetics or dental research or what do I do, at least they can land up on a page where they can see the problems. Because like Dr. Swapnika said, we don't know how to make a change. And I'm sure like a lot of people are motivated towards making change, because we're all healthcare, we take professionals and we need to take care of a
Absolutely.
problem. So, so we basically need courses that collaborate these two ideas and have different professionals from across the board. It could be dental professionals, it could be researchers, it could be somebody from the pharma company just introducing an idea to the children or to those students in different courses, and just stimulate a single idea in somebody's mind, and that's where we will probably land up with a problem and then look for solutions together. So it can't be independent, it has to be like we need to have a platform which combines all ideas, and that's a start, because there's always so much more to be done, and there's always like educational reforms that's going to happen or they're going to be late. But the very fact that's in our hand, the very fact that we have the internet, we can do it much faster. I mean,
Correct.
we don't need to be we don't be waiting for a change in curriculum. So that's something I think I should urge everyone out there who's like inquisitive about research, about dentistry, about anything at all, or that core problem in your mind. Yeah, don't wait for a change in education. That's not going to happen very soon. And yeah, it has to come. Yeah, it has to come with reaching out different professionals and having a platform where you can talk and know
Right.
that the problem exists and you can be the change maker.
Absolutely. I absolutely agree with what you said. And this is the reason why I always try to get connected with young minds like you, because there's a lot of energy, a lot of blunt truth that comes up, and you have that guts to speak. So because as you grow older, so we start thinking, we will make jalebis in our mind. Oh, I am doing this, so I can't speak this. So there are a lot of things like that. But I think all the insights that you guys gave was amazing and fantastic. And Shalin, I am taking something, I have taken a lot of learnings from each one of your insights. And that's not just I'm telling because we are speaking online over here, but that's true. Because some of the points which are very, very pertinent, one Dr. Roma said about the awareness. So I think we really need to do something on that. Then everybody's insight is important. And particularly, Shalin, that you said that we really need to create this co-create, I mean a co-community, rather than putting things apart. And I really like that idea what you say, that if there can be a forum where people come and pitch their ideas, or they train students in some way. Well, I'm just trying in a small way, in my own limited capacity, just to bring these interview shows that you see every Friday we do basically. But then this was very important, so I just kept this panel discussion slot for my on the interview slot. But then I think wonderful ideas came up, and at least I'm speaking on a public forum, so I'll try my best to do something of all the insights that you guys give. I'll try to do something new as well. So it has really opened my mind. Well, coming back now to the, we are almost at the concluding part of our session, and I think it always little bit overshoots time. So, and I'm feeling bad for Swapnika. She's she's really all of us are quite at the end of the day, but she has to begin her day. So I'll not hold any more to any of you, but I'll definitely answer the question of Dr. Swapnika, that how to select the which what I should research on. Am I right? Did I understand your question correctly? Well, well. So this is a very favorite topic, which I would like. I can talk on hours. Here is a problem when we talk the till the term research itself. When we are trained as dentists, we cannot think, because we are. It's a very professional course. I mean, technical or technique oriented course, and particularly Swapnika, that you are in the US. I think to be very honest, you will get a lot of exposure of interdisciplinary work, but in Indian system we definitely lack that. But yes, things are going good, things are coming up, that's things are changing. But just to come to one point, see, research doesn't mean that. What is research? First of all, we should understand that research is research. That means it is an existing information, you just need to dig it out, and you have to present it in a more conclusive way. That is research, simple. Now how can we do that? We can do that in many ways. So first I should see that what I have in hand. So I if I don't know anything about some technologies, I don't need to take up a molecular study, breaking my head here and there, bumping into somebody, and getting frustrated, and maybe spending a lot of money. That is also not your own money, your parents money. So I don't think that is a good idea. So how can I start? Starting point can be two things. One is that it's an idea you can try, if like when you are a student, or maybe if you are into any kind of clinical training, when you are just coming out of the college, or you are inside the college, like Dr. Padma is still seeing patients, and she will be knowing, because in MDS they have to collect the data and all. Just by seeing data, just by analyzing daily practice data, you can bring up lot of insights, and you can contribute to the science. It is not always necessary that you have to sit with gadgets and instruments and do AI and stuff, and do blah blah bush bash, and then only you can publish. It is not like that, okay? That means, and how can be that? One example, like for example, Dr. Mayuri was telling that she has seen a lot of village patients. Even I have seen, like when I used to practice. I don't practice anymore. Well, so when I saw that, because I used to see oral pre-malignant lesions a lot, because my practice was also a rural area practice. So what happens is that we can, if we observe, if we know how to observe and analyze those daily patient data. I'm not telling for every patient, but you need to understand that filtration and segregation. You can actually understand what is the incidence of oral cancer in that particular region. So this kind of information, which is absolutely necessary and very, very important, you can just do on an Excel sheet. So this is research. Second thing, now like for example, you want to solve a problem. So it can be a very, very simple problem. I will not take the name, like this is one of my friend's idea, but then like we take x-rays. Okay, I don't want to put her idea out, but then how can we modify that? Because that's a 2D image. Okay, and everybody cannot get CBCT in the first place. If you're starting your clinical practice, everybody cannot even get what is that called, RVG. where you get a computerized image. It is not possible. At least in rural dental practice in India, it is very costly affair for the dentist itself. So can we do something about this? Can we do something, talk to some IT guy or some 3D animation guy who can just tweak this and make it an affordable solution? So this is also a research, because you have to learn, unlearn many things, you have to collaborate. And another thing I want to explain here is that when it comes to research, the mindset has to change a bit. As I said that, like, don't mind Dr. Roma, just like you, many dentists who are general dentists who are practicing, they say, I am just a dentist. And I always uh, go against this statement. You are not just, because if you are something great, because you are just like a plus 10, I mean class 10 student. Today you give, today anybody of us take go back to school, we will all fail. I can guarantee you, we will all fail class 10 or class 8 exam. Just imagine how many subjects we used to read. So that is how we have to think. So you are covering a lot of areas, lot of specialities. Now two things in research is very important that you have to understand from, even if you haven't stepped into. One is that you cannot do everything. Even if you are Einstein, still you cannot do everything. So you need to understand what is your strength, and you need to find out that the type of work that you are trying to do. Suppose I say that you have to, you can build something around that 2D X-ray to make it 3D or something, but not costly as RVG, or expensive as CBCT. So you cannot learn AR VR now, na? You have to go to you have to just go to the relevant people and collaborate with them. So research can grow only by collaboration, and the only mantra is that you bring experts in one place. You have some expertise, you get another expert for your work. Yes, what you need is to understand how to search these correct people instead of landing up in wrong places. This is another. This is one thing. Now, as a career, if you want to choose, like you want to become a scientist, where you really want to sit in the lab, you don't want to go into clinical practice, but you want to sit in the lab, that is another option. So that is completely different. So that will take you, that definitely there are two three ways. One, if you have a guide who will tell you, okay, you are already in an existing scenario, ecosystem you are starting. Second can be like, it can be just your idea, and you can start working on it and take help from business people, business leaders, contract research organizations. Go to funding agencies, talk to them. There are, in India as well as abroad, there are a lot of endeavors that are being done from the government side. Like in India, we have different biotech parks in many cities we have. And now every university is coming up with their own this is called incubation centers. So there basically you just need a graduation degree, and you don't need anything. You just need to be a graduate, and you can implement an idea. They will mentor you, because when it comes to commercialization of an idea, like if you really want to become an entrepreneur or a scientist that way, where you want to bring up your own product, that's another route of career. But there are a lot of challenges, and you should know how to get funding. What are the ways? It is not like your academic funding, writing to some government organization, and your work is done, published, you are happy, forget it. It is about actually getting your feet dirty and solving the social problem, right? So this is another aspect. And as I said, that if you want to really become a scientist, living every you have to leave your clinical practice. So there needs a mindset shift. So this completely depends on the individual, right? So in that case, what you can do, you can choose any area which you like more, and you can search relevant people. And it is always a good idea when you are starting fresh, or you really don't have a very guided path, to work under somebody. That's the best way you can do, to do short projects here and there, just like you do internship. Why you do internship? You just hold the suction pipe and stand, right? Why? Because it's observership. So you have to observe. It's not wrong. That is how things start. Here also it is. So if you observe, go to different places, take up short courses, do whatever you can, because you need those skills. So that's why I always tell abbreviation, and I'll end it, because if you give me the mic, I will keep speaking on oral healthcare research, and the entire program is goes. So just to conclude, I tell that we need to ask ourselves. And what do we ask? So I break ask into three things. One is attitude. So you have to change your attitude towards seeing a thing. That is the change of perspective. Like all of you told about holistic treatment approach. You told about interdisciplinary way of thinking or seeing to it. Like Shalin told that it should be a group, multidisciplinary group. Yes, so that is an attitude, but traditionally it's not like this. So there's a attitude change. So you need to do that. Second is S is skills. So you have to have some basic skills before even you delve into that part. Like for example, if you are wanting to do something with AI or AR, I mean virtual reality or augmented reality, at least some basic idea you should have about it, little bit. So do a basic course. You don't have to become a AR VR specialist, but before you go and speak to the specialist, you should also know now what you are speaking. So that is the skill. And definitely the knowledge. So that is ask, attitude, skills, knowledge. So get knowledge from wherever in the world you can. And as Sarin said that with the power of internet, everything is at hand. So I think I answered your question in extensive way. And if you have more questions, I think we'll come up like this with more discussions. And let's wind up for today. And thank you once again so much. It was wonderful talking to all of you, and I got a lot of insights, and I got really energetic. Thank you guys. Thank you so much. Thank you.
Thank you so
Thank
much.
you.
Thank you, ma'am. Thank you
Thank
so
you.
much.
Thank you. Thank you.
Okay, so I hope all my viewers you have enjoyed this session. If you haven't joined in the live, you can watch this video here, and we will put up whatever the questions we have asked in the description. And for the answers, you have to watch this video. So definitely, because all the answers are very insightful, and I think this panel discussion has. Anyway, somewhere has enlightened one mind, then that's our success, and that is what we are doing through this type of programs. Thank you so much for tuning in, who have joined us in the live, as well as who will be watching this video later. And subscribe my channel, and you will get more information and notification. Well then, stay well. Good night. Take care. Bye bye.